Hello friends, this is a video where we are going to understand what are the things which comes in an OBG department and how to approach. You go to OPD daily in your respective colleges, and if you don't know what you are seeing and you don't know how to approach, there is no point in what you are seeing. It's because your eyes sees what your brain knows, right? So understanding what to approach and how to approach is something which is paramount of significance in any OPT. So for that, we'll see how to approach uh, this particular department. Okay, first let us see what are the things which we are able to get to see in an OBGYN department. Okay, if you take OBG department as such in an OPD, almost 60% of the cases are related to ops and 40% of the people are related to gynec. And for this approach, I have already did a special video for approach to gynecology, right? So this is something which we are going to deal with it now. So if we convert the 60% into 100 patients which we see in ops, okay, so we can classify the people as, see, almost 80 to 85% of the cases which you get to see in your day-to-day practice is antenatal cases. Okay, then almost 10 to 15% of the cases which you get to see is high risk pregnancies. Okay, then almost 5 to 10% of the cases which you get to see is non-ANC. What do you mean by non-ANC then? Postpartum complications, okay, those are the things which are going to include. So now see, now if you attend an OPD, these are the cases which you can probably come to see. Okay, now let us further break down this. See, this is something which is very important. If you don't know this, then there's no point of you going to OPD. If you don't know, then you understand my point, right? So now let us divide this ANC into trimesters. Okay, now this 80% of ANC cases which you see, right, are first divided based on trimester. Okay, this is first trimester, second trimester, and third trimester, correct? So almost 30% of the cases are from first trimester, 25% are from second, and almost again 25 to 30% are of third trimester. See, you might feel why this person is emphasizing more on statistics. See, statistics is something which is fact, and when maths comes to biology, that is when the game gets interesting. If you know stats, you know what you are dealing with, you know what is common, right? So that's something which is very important. Now coming to first trimester, see, what are the things you do you think you can see in first trimester? See, usually they come for scanning. So what do you think are the chief complaints which constitute first trimester is something which you're going to see. See, first trimester is nothing but 0 to 12 weeks, correct? So what do you think is the most common complaint here? Yes, you're right. Major is nausea and vomiting. Okay, next, she might come up with lower abdominal pain. Okay, then she might have complication. She might come up with vaginal bleeding. Okay, then she might also come here with discharge. So you should know what is physiological and what is pathological even in these cases. Okay, these are the basic chief complaints of first trimester. Okay, now coming to second trimester, major complaints which you are going to encounter in second trimester is again back pain, which is something which is more important because fetus is growing. And also you might here mostly you can see the urinary disturbance symptoms also, because uterus as such is pressing or irritating the urinary bladder. Okay, now here again you might get all this back pain and stuff, and also the lower abdominal pain which is the same. Okay, then also this vaginal bleeding. That means there's something pathology, right? You have to evaluate for any abortion or anything. Then again here one more thing which I need to mention is fever with rash, right? That is something which you need to look into, you need to ask. Okay, then also why do you think I am more worried about urinary symptoms in pregnancy? There's something called as asymptomatic bacteriuria. Even if a patient doesn't come to you with chief complaint, it's your duty as an obstetrician to deal that case if it is significant for asymptomatic bacteriuria, then start her on prophylactic antibiotics, because she doesn't come to you with symptoms. So every trimester, when you're doing a routine checkups, you need to do a urine culture. Okay, that is something which is very important. I think this with other symptoms constitute the second trimester patients. Now, third trimester, what do you think is the problem? Major is again, what do you think? Yes, again abdominal pain. Okay, breathlessness is something which you need to think about, and I don't think you need an explanation for that. And also discharge. Okay, then what do you think? Swellings. So there's something called as physiological swelling in pregnancy and pathological, which we will deal in subsequent classes. Okay, so this is something which you should know. Got it? So now 80% of ANC cases, how do the patient presents with, right? So this is something which now. So there is nothing to worry. So this is done. Now let's focus on this part. 10 to 15% of high risk cases. Okay, they're saying 10 to 15% of high risk cases. So what do you think high risk? That means she required extra monitoring in this pregnancy. Okay, so what do you think? I mean, if you have attended, you will know by now. Yes, what is most common in India? Diabetes, GDM, then hypertension, that is gestational hypertension, and also gestational diabetes. Okay, next, what do you think? Any IUGR kind of features, then any preterm labor, yeah, then any seizure disorder. Okay, then others. What do you think you can include under others, which are very broad? For example, APLA, for example, SLE. These are something like 1 or 2 patients which you're going to see in 10 to 15%. Okay, these are something which constitute the more. So you should know the more part as a primary healthcare physician. This you can refer, right? So this is something which you know. Now, yes, 80 plus 10 to 15. Okay, almost 90%. Now let us jump to the non-ANC or non-ANC cases which you see. Okay, non-ANC part. That is, what do you think? After pregnancies, that is mostly postpartum complications like infections, like mastitis, then any lactational problems. Okay, then secondary to PPH for follow-up. Okay, all this missed abortion, ectopic pregnancies and molar pregnancies can also be included, but I consider it to be under ANC as such. Okay, this is something which you should know. So this is almost 5%. Okay, so listen friends, so now have an overall idea like how does an OBG department works. For this, I think I have dealt in the approach to gynec video, which is there in my channel. Please go and check it out. Okay, now as such, now you know. So what do you think is the inference from the statistics which I have derived? That is, as a primary healthcare physician, your duty, or you're expected to be a better obstetrician than a gynecologist. Okay, your duty, it is your duty to be a better obstetrician than a gynecologist as an MBBS graduate. Okay, so now what are the cases you see, and what are the chief complaints that come about it. In the subsequent videos, we will work up the particular chief complaint with particular work how we did for gynec. Okay, now what are the cases you get. 80 to 85% of them are ANC, 10 to 15% of them are high risk, and 5 to 10% are non-ANC cases. Okay, this is something which correct. So this forms the gist. Okay, this is something which forms the gist of your OPD, of your OBG. Got it? So register this in your mind. Okay, this is something which is very, very important. Got it? Now coming to the proper things which we follow. See guys, as I've explained to you in earlier classes, this is the approach which we follow. Correct? That is anatomy, then physiology and pathology. See, as I told, we have divided into the uh, 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 subsequent strata. What do you mean by strata? See, here if you see, for a pregnancy, four important things is required. Okay, what are those? The brain thing, that is pituitary, hypothalamus should produce GnRH, that should produce LH and FSH, and that should act on ovary, and that will produce either estrogen or progesterone. Okay, why this is important? If there is any hormonal disturbances, then you will not have a pregnancy at all. Is that clear? Okay, so then what else? What are the things which are included in the particular as such? This approach is something which you should know. Now you know what are the cases you see. Now, how to derive a particular case, how to approach a particular case is something which we'll discuss in our next video, because now you know what are the cases which you are going to see. Now, based on our approach which we follow, in our next video we will discuss what are the cases specific to each department, specific to each pre-paraclinical subject, how we will correlate and how we will derive to a proper conclusion is something which we'll see in the next video. Till then, stay tuned.